Okay, I just got a phone call that I need to head in to room 215 and assess with a patient with manual ventilate the patient. On my way, I'm going to go ahead and grab, she has a compromised airway, so I'm going to go ahead and grab some oral pharyngeal airways, different sizes, and also an Ambu bag. So, upon entering, knock on the door. Hi, it's Kate from respiratory. The nurses are working on the patient right now. The patient's not responsive, so I'm going to go ahead and put some hand sanitizer on, put on my gloves, and go ahead and measure and see what kind of size would fit best. Oral pharyngeal airway will fit best. Mrs. Smith, the first one looks best. It goes from the tip of your mouth to your ear. So her SpO2 is very low, in the low 80s. I don't hear her moving very much air at all, and I don't see any chest rises. So what I'm going to do is go ahead and do a chin tilt here. I'm going to use this closed Goodell size 10 centimeter airway or pharyngeal airway. We're going to go ahead and insert upside down and then halfway do a 180-degree twist. So now that flange is resting on Mrs. Smith's mouth. I have secured the airway, so if she bites down, I can still administer her breaths. I'm going to get my Ambu bag, hook up the oxygen, probably to, if there's a canister on her bed, I'm going to do it to the bed just in case we have to go in where. And I'm going to go ahead and get at the head of the bed, have a chin tilt here, and start administering breaths to Mrs. Smith. What I'm looking for here is chest rises. I have a secure seal around the mask itself, and I'm going to allow that Ambu bag the bag to refill on its own, so we get the maximum FiO2 to the patient. If Mrs. Smith was a congestive heart failure patient, we want to make sure, we never want to hyperventilate a patient, but especially a CHF patient. So her breaths per minute would be in between 8 and 10, 12 breaths per minute on a CHF patient. So I'll continue to do this until further instruction. I am mobile. I can go ahead and walk if we need to go to the OR with the patient, the ICU, if the patient needs to be intubated or trached, or whatever needs to be done.